Good evening. Look and feel young, go to the dentist. Okay, my first question to you is, if you go to the dentist for your annual checkup, what is it you expect? Hi, doc, do I need a filling? Will you take an x-ray? Are my gums okay? Where do I pay? Or do you expect something more? Now, when I was a kid, I used to look at my granddad sitting in his wheelchair. He was about 60-something, but to me, he always looked like an old man, especially without his dentures. Now, did you know that our jaw, and more precisely, the position of our jaw, determines for a big part how old we look? The height and the contact between our teeth can make our face look longer or shorter, younger or older. A young, beautiful face normally has 3 equal proportions. In his days, Leonardo da Vinci had already discovered that. Here you can see his beautiful Lisa and some more modern icons. Now, if we lose height in the lower part, this completely disrupts that proportional harmony. Our face changes, we look older. In the same time, this can generate a lot of subsequent problems before we didn't relate it. Like, for example, headaches, neck pains. Why? Because it's all connected. In the same time, it can cause also a bad sleeping habit. We are awakened because of muscle tension. Good. Now, if we analyze our skull, our mouth, the position of our jaw when we bite is determined by the contact between the teeth. And it must be in a correct position. And what do I mean by correct? So that the muscles, and there are a lot of muscles, as you can see, can function in a normal way without getting overload. And in the same time, the meniscus, similar as we have in our knees, can have its space to guide the movement of the jaw. So when that space is compromised, we can have joint problems. For example, clicking of the jaw, blocking of the jaw, joint pains. So in the next 9 minutes, or should I say 8 minutes and 12 seconds, I will try to explain you why we can have a problem with our bite and what to do about it. So I hope in the future you will see your visit to the dentist from another point of view, maybe giving another dimension to your dental visit. So the first reason why our bite changes is when the teeth at a young age don't have the space to come out at the correct place. So they seek a way out, and we have a situation we dentists call crowding, too many teeth in too limited space. When we bite, we always try to seek maximal stability, so in most cases, the jaw slides into a different position, causing all the problems. The second situation is when there's too much space in between the teeth due to early extractions, for example. So the remaining teeth start moving and our bite changes. When our bite changes, in many cases, it is believed to be the cause of a grinding or a clenching habit. It is a habit we do at night with extreme forces, and those extreme forces, 10 times more than we can do normally, that can cause an extreme wear of the teeth, fracture of the teeth, and loss of the soft and hard tissue surrounding the teeth. At the same time, this can generate muscle tension at night. We wake up at night, we wake up grumpy, and at the same time, because we lose height, our muscles pull the jaw deeper and deeper inside of the skull, and our appearance changes. We start looking older, and we do not want that. We want to look and feel young. Now, what can we do about it? So, at a young age, when we still have our teeth, we have to protect them, since it is a habit we cannot control, especially at night. So we use a night guard. This plastic, custom-made, hard, transparent protection device protects our teeth from wearing, from fracturing. In that way, at the age of 80, we will still have our 20-year-old looking teeth. So if we take a selfie at the age of 80, the age-determining app of our camera will be so confused. Now, this is a photo of my wife. She isn't 80, but neither is she 29. Good. The second situation, when the teeth have already been lost, and these are cases I see every day in my office. So the thing we must do, we must rehabilitate the mouth, make it more beautiful and better than it was before. How to do so then? First, by doing a correct diagnosis and determining a good bite. Nowadays, this diagnosis is done in most cases with computer. So we design the teeth, so later on we 3D print it into a plastic try-in the patient can put into the mouth to get the extra motivation sometimes. And for us, it gives the certainty for the end of our treatment. And in that way, the patient can be motivated to do the sometimes very expensive treatment. Good. As a member of the APOCLAR Medical Advisory Board, I am helping to develop the Microsoft HoloLens for dental applications. It has infinite possibilities. As you know, the Microsoft HoloLens is a computer which uses augmented reality. And one of the applications we are now developing is the following: to place our dental implants. So we upload the CT scan inside the HoloLens. So thanks to the augmented reality, the surgeon can see that CT scan. And when we start doing our surgery, the CT scan is matched onto the patient with a visual recognition. In that way, it can be projected, and when we start working, we work directly into our CT scan. This is a state-of-the-art technology which has already been used in brain surgery and head and neck surgery. Now, in most cases, when we treat those as we call them, those compromised patients, we have to work together with different kinds of dental specialists. We can't do it on our own. Every specialist uses his know-how, and in that way, we try, like an orchestra, make something beautiful out of it. The dentist who will finally place the teeth, the prosthodontist, is the dentist who wears the responsibility. He is the dentist responsible for restoring the teeth, giving back to the patient their aesthetics, their gastronomic quality time, and a part of their youth. I hope you realize that going to the dentist, thanks to the technology we have, must be looked upon a different way, not only teeth by teeth, but it's a general treatment to make our patients better. They must feel young, but also the looks, they must look young. The preventive aspect is the best we can do, but in many cases, the damage has already been done, and then it's a question of rehabilitating our patients. So we must step up from the idea that one day we will look old, we go to sleep, put our denture into the glass, and we wake up with our usual migraine. Like Dan Brown said in his latest novel, the next race after the Homo sapiens will be a race of humans applying technology into their daily life so we can live better, we can live longer, and make a better world. He calls this race the Technium. This is a part of it. We are Technium. Thank you.